Welcome, everyone, to our first ever community-wide conversation on homelessness. We're just thrilled that you're here today. My name is Christine Nealand. I am the chair of Homeward 2020. Homeward 2020 is an organization dedicated to the 10-year plan to make homelessness rare, short-lived, and non-recurring in our community. And it's gratifying to see you here. Between this morning and this afternoon, we have between 160 and 200 people who are taking time out of their lives to have the community conversation on homelessness. And as we all know, that Fort Collins is a community that excels in addressing our opportunities and challenges in a way that makes our city one of the most livable in the country. And we're looking at how we can make it most livable for everyone. And so thank you so much for taking your time today to be here with us. This is not a closet, but we know for some people it is. And if this is what you use as a closet, it is hard to apply for jobs. It is hard to keep a job. It is hard to support your children in school. It is hard to attain the potential and the dignity of the potential that you have as an individual. And we know that we believe that stable housing, permanent supportive housing, is a key to stable individuals, is the key to a stable community. So at the end of the day, everyone having a stable lifestyle is fundamental for the kind of community that we describe as a livable, sought-after community, and the one that we have appreciated living in. I'd like to thank our sponsors. It's just intensely really inspirational to see who's come together to make this day possible. The City of Fort Collins, the Fort Collins Chamber of Commerce, the Bohemian Foundation, the Governor's Office on Community Partnerships, United Way, Serve 6.8, who also runs the Murphy Center, Fort Collins Housing Authority, and Homeward 2020. So let's give a round of applause to those who made today possible. And a sincere thank you, because they not only funded it, but they've also been working on it, and it takes a lot of work to put something like this together. So thank you so much for the organizations that have stepped up and made this first community conversation on homelessness possible. I'd now like to introduce our mayor, a good friend of mine, and Mayor of Fort Collins, Mayor Karen White-Cannot. Karen has believed in the power of community conversations the whole decades that I've known her. She's been a leader in our community for many years now, and really responsible for a lot of what you see happening and what we're all experiencing in the dynamism in our community right now. And truly believes in the power of the people here, all of us, to make our community and to create the kind of community that we want. So, Karen.
Good morning, Fort Collins. It is a great day in the city of Fort Collins. You know, I want to begin by thanking you so much for taking the morning out of your busy schedules to be able to come together and have this conversation. In particular, I want to thank the sponsors of this event. You know, it's people working together. It's government entities, it's nonprofits, it's institutions and faith community. It's all of us in this together. And that's exactly why we always say, you know, this is Fort Collins, continuously named one of the best places to live, to work, and to play in America. We are engaged. We show up, and we work together to make things better for all the people in our community. Today, we're talking about live aspect of the live, work, and play in our community. A strong community is one that works for everyone. This means having options in housing. It must be affordable, and it must be available. The city of Fort Collins is committed to addressing the issues of housing affordability, homelessness, and poverty, but we cannot do it alone. Homelessness is multidimensional. It's an issue that requires collaboration and coordination. across an entire community of business, nonprofits, governments, faith-based institutions, and the citizens. It involves someone providing 27,000 nights of shelter to thousands of individuals. It involves serving 1,400 households with foreclosure prevention counseling, or providing rent assistance and a small $300 grant to help over 20,000 families stay in their home. Today, we're talking about building on the foundation with your ideas on how to work together to build a stronger, better community where all people have options for housing. That's why we're here today. Thank you. Thank you for being here, for sharing. I'm really excited about the conversation, as I know you must be too. So thank you. Thank you for choosing to help your community. Let's have a good day.
So good morning, everybody. My name is Heather Lyons, and I work for CSH, which stands for the Corporation for Supportive Housing. We're a national organization. We have offices throughout the country, and I get to work on a national team. I'm on our national consulting team. We have about 14 offices throughout the country. Our primary role in those communities is to help develop supportive housing for people who need it in those communities. But we also do a lot of work around homeless systems work, and we do a lot of work around facilitating community conversations, and I'm really excited to be here today. I've been with CSH for about 6 years. I live in Portland, Oregon right now, and I've been there for the past 14 years. Prior to joining CSH, I worked for the city of Portland, and I worked on homeless issues with the city of Portland. So, in fact, I've been working on homelessness my whole career, which is kind of a weird thing to have a career in, but it's been really rewarding and really wonderful. So I'm really honored to be here today, and thank you for having me.
Hi, I'm Vanessa Finley. Most of you have talked to me on the phone or gotten an email from me. I'm the current director of Homeward 2020, and we're a community initiative, and it's our vision for this community to make homelessness rare, short-lived, and non-recurring. And we do that by really driving the implementation of a 10-year plan. And that plan outlines strategies that we know work in order to end homelessness here. They're evidence-based, based on best practices and what we know works around the community. And there are over 250 communities currently that have these 10-year plans. And a lot of people ask kind of where are we with this 10-year plan, and so we did want to share a little bit of information. Since the 10-year plan was launched in around 2010, we've increased the permanent housing options for veterans specifically by partnering with the Veterans Affairs and with the Fort Collins Housing Authority, as well as, of course, developing Red Tail Ponds, which will open in about 5 or 6 weeks, which is another permanent supportive housing option for individuals in our community. Increased mental health and substance use treatment, as well as medical care through Medicaid expansion, and implemented a street outreach program through Homeless Gear. We've increased shelter options for families, increased transitional housing options for families and for youth, and implemented a cold weather emergency shelter so that nobody has to stay outside in inclement weather. Those are just a few things that this community has done in the past 5 years, and where we're really hoping this conversation can go today is outlining those next tactical steps that will take us to the next step, that will really making homelessness rare, short-lived, and non-recurring a reality. So I'm going to turn it back over to Heather a little bit, and she's going to continue to talk about types of homelessness that we see, some definitions, and we'll share a little bit more information about homelessness here in Fort Collins as well.
When we talk about homelessness, there are a lot of images come to mind, I'm sure, from people who are literally sleeping outside and who have to use the shopping cart for their closet, to people who are couch surfing, to people who are doubled and tripled up. And so there are various types of homelessness, and so this chart sort of lays out those types of homelessness, and there are the unsheltered folks, and those are the folks who are sleeping outside, in vehicles, in places not meant for human habitation. Literally homeless includes all of those folks and people who are in emergency shelter. HUD's definition, Housing and Urban Development, which is a primary funder of homeless programs, includes all of the above and people who are in transitional housing for individuals and families. And I should say unsheltered and literally homeless can include families with children as well. And then the broadest definition, which HUD doesn't recognize in terms of its funding, but we recognize and many communities recognize that it's still an issue. People who are doubled up, couch surfing, and it's largely due to a lack of housing, loss of income, whatever it may be, but don't have their own home to live in.
So these are what we call our point-in-time numbers. We do an annual survey, and this is actually something that communities across the country do during the last 10 days or so in January as a requirement by Housing and Urban Development. And so based off of last year's numbers, we had in the United States around 610,000 people who were, again, met that definition of literally homeless, and so they're staying in emergency shelters, they're staying outside on the streets. In Colorado, we had about 9,754 people, and then in Fort Collins, we counted 289 people. And so one of the interesting things that we get comments on is, is homelessness really an issue in Fort Collins? And of course, for anybody without a home, that's a huge issue for them. But what we've actually done is when we look at the total population in the United States, in Colorado, and then here in the city of Fort Collins, it actually breaks down to a proportion of 0.19%. So proportionally, we do have an issue that is comparable to what we're seeing throughout the state and really throughout the nation. So we did, like I mentioned, we usually do this point-in-time survey every January. We actually did one last summer because we had this perception that things look different in the summer, and in fact they do. And so these were some of the questions that we had asked for the first time in the summer. We're asking them again next week when we do the point-in-time, and it'll be really interesting to compare those data points. But what we found was that about 41% of people who we had surveyed had experienced their first episode of homelessness here in Larimer County. About another 20% had come here from other parts of the state, and the majority of those coming from Weld County, Boulder, Denver, kind of in this area. And then 39% had come from outside of the state or from overseas even. We also asked for those people who had come really from out of state, from other parts of the country, why did you come to Fort Collins? And the top 3 reasons that were cited were really to be with family and friends. They had some connection here. They had a support system that they thought that they could tap into for work or education, and then for community of life or quality of life or community factors. So these were people giving answers like, the weather's nice, I heard it's a nice community, a couple people talking about how it was a safe community and they felt safer here. So those were the types of responses that came into that for those 14% of people that came here for those types of factors. We also asked, why did you become homeless? Why do you think that you're in your current living situation? And a lot of people had multiple factors going on, and so these aren't necessarily exclusive categories, but generally the biggest reason, they were financial. They said, my rent's too high, my wages are too low, I can't find a job, underemployed or unemployed. Health and disability was also a pretty frequently cited reason that people became homeless. And then some sort of family status change. And so that could be a divorce, it could be domestic violence, or it could be someone in their family passing away, which was enough to kind of launch them into homelessness.
So I'm going to talk a little bit about other homelessness and other communities. And basically, there's a question in I know there's a question here, and there's a question in every community, are we attracting homeless people? And I just want to say a lot of people have this question. And so Seattle, near my part of the world, San Francisco, also from my part of the world, Boulder, closer to your part of the world, Portland, Maine, not Portland, all over the country, people are wondering and questioning, are homeless services and homeless programs attracting people who experience homelessness? So I'm not going to say absolutely not, but I also will say pretty strongly based on my experience, it's not the primary reason. So nationally, and this comes from Martha Burt, who is a long-term researcher in the homeless field and works for the used to work for the Urban Institute. In a statement she made in front of Congress, nationally 75 to 84% remain in the same area where they've lived. Now, it may not be the same city, but it's very close by. But for the most part, there's not a lot of people traveling amongst state to state or up and down the highway corridors or whatever it may be. But there are some, but by and large, most people stay in the area where they come from. There was a study in Los Angeles that said that there was a lot of movement within the city of Los Angeles, or the county of Los Angeles, which is quite large, in terms of people trying to access services and trying to find supports and trying to find ways to get out of their homeless or whatever they may need at that time. And they were also looking in for location of resources and social supports, but that's a lot of movement within Los Angeles County. The same study, and this was conducted in 2009, found that the majority of homeless men, and they just looked at men, they were stayers rather than movers. And this is a statement from the study that says, this obviates a common political strategy by localities attempting to avoid obligations to provide support to homeless individuals on the basis of their transistency. I'm not suggesting that that's happening here in Fort Collins. In fact, I don't feel that way or haven't heard anything like that at all. But in several other communities that I've worked in other states that may not be so open and understanding about people who experience homelessness, this is a clear strategy that some communities employ. And this study found that it basically does not work. So Portland, there was a study done in Portland, also done as part of our point-in-time count. 59% of the folks that were counted in our point-in-time count had been in Portland for 2 years or more. 20% were less than 2 years and were homeless when they arrived. So they didn't come to Portland and become homeless. They were homeless when they arrived. So 20%, a good amount. Most common reason was family and friends, not unlike Fort Collins. They knew somebody in Portland and came. And also, what we found is that a lot of people came from suburban and rural parts of Oregon to the city. Like many people moved to cities for more opportunities more opportunities for supports. There's just more in Portland than there is in some of the suburban and rural communities in Oregon. Again, same. It's very interesting how similar these studies are, or these questions were. Relatives was one reason. Escaping domestic violence was another reason, and there was a job opportunity or a school opportunity, and those were primary reasons people came to Portland, and that were counted in the point-in-time count. So while we would love to open it up for questions and answers, we really want to make sure we have enough time to have the full community dialogue and full community conversation. So if you do have comments or questions, we'll ask you to save that until we open it up. So let me explain a little bit of how it's going to work this morning. I'm going to spend about 35 or 40 minutes facilitating what we call the inner circle of experts, and that's a group of folks who are about to introduce themselves. They have a variety of perspectives and experiences around the issue of homelessness, and we're going to have a dialogue. We want people to have a conversation and share their experiences and perspectives and expertise. We recognize that the full room also has a lot of expertise, and so we want to make sure we hear from as many of you as possible. So when we're done speaking there, we're going to open it up to the room. While the middle group is talking, we're going to ask that you sort of sit back, take notes, think about what you want to say or what you want to ask. When we open it up, we're going to ask that you just make comments, maybe respond to other people or respond to what you heard in the circle. We don't want to have questions to the inner circle, because the primary reason for that is this is a big room, there's a lot of people here, and we want to hear from as many people as possible. And when you ask questions, it just takes time away from you. And there's information about this on your agenda. So when we get to you, we're going to, the ground rules are essentially allow for one person to speak at a time. We're taking lots of notes, so if a comment has been made, you don't need to repeat it. If you support it, that's great. You can show your support for that comment, but it's been recorded. We want to get as much diversity in comments as possible, and we want everybody to get the opportunity to speak at least once. So if you've had an opportunity to speak, we're not going to come back to you unless we've gone through as many people who choose to share their comments today. So any questions about that before we get started? Oh, the Twitter, yes. If you can also, if you are Twitter savvy, you can make your comments on Twitter. That's hashtag FTC Homeless Conversation. If you have pictures you want to take and put up there, whatever you want to do. Our CSH has if you want to include us, at CSH Info is how you get connected to CSH. You don't have to. We're more interested in getting comments from you. So that's another way that you can share comments, is through Twitter. We'll collect those as well. If you're not Twitter savvy, don't worry about it. It's not a big deal. Good morning. Okay, so why don't we start with just quick introductions? Do you want to start?
Sure. Hi, my name is Jean Bosch, and I'm the manager of Old Town Library here in Fort Collins.
Hello, my name is Susan Weimer, and I'm a resident right now at Catholic Charities, the Mission. I've been homeless 3 times since I lived here in Fort Collins because of income.
My name is David Root. I'm the Executive Director with Homeless Gear.
I'm Zachary Penland. Up until 3 weeks ago, I was running the Murphy Center, and now I'm with the Housing Authority and will be running the Red Tail Ponds Permanent Supportive Housing Project.
My name's Ryan Hodak. I'm the owner of the Melting Pot, Rodizio Grill, and Social down in Old Town.
My name is Todd Hopkins. I'm a Fort Collins police officer.
Good morning, everybody. My name is Jeff Mihalik. I'm the Deputy City Manager here in Fort Collins.
Thank you. Thanks so much for agreeing to be in the fishbowl, too. So we have a few questions, and we don't have a whole lot of time, but let me start with an easy one. What is the one challenge in the area of homelessness in Fort Collins that you think needs to be addressed first?
Should we all jump in at once?
Whoever, if you feel it, just do it.
I'll take a stab at it. I think, hopefully our goal is to make sure that we're providing housing for people that are homeless, but equally and more importantly is to provide the services, support, and caring to make sure that people don't become homeless again. Getting them sheltered initially is only part of the issue. Keeping them out of being homeless is the bigger issue I think we all face.
Yes.
Go ahead. Go. Please.
Yes, the reason why I'm homeless this third time is because I was in a unit. I had an apartment. Housing Authority failed the inspection, so HUD wouldn't pay the rent for that month of September. So that's why I got homeless again. It's because, low income and stuff like that. They need more low income housing, basically. And the inspections need to be more. The property managers need to be more educated on how to rent and how to have their places inspected.
Can I just extend off what you were saying up there about
Sure.
this idea of Fort Collins being sort of a magnet community for homelessness? And I actually think that's one of the bigger challenges that we face as a community right now, this perception that services are a part of the problem, that we're drawing people here because of the services that we're providing. And to be fair, the data that you showed does show that there are some people coming, particularly from the surrounding communities, to access our services, and I think that's a natural sort of outcome of having additional services. But the numbers aren't huge, and I think we risk missing the bigger picture if we focus too much on reducing services in our community. My concern is that if we do that, we might get the 100 or so, if that's probably a generous number, but we might get a certain segment of the population to move on to another community. But the vast majority of people experiencing homelessness in Fort Collins who became homeless in Fort Collins will still be here. They won't have the services that they need. They'll be farther from self-sufficiency. And ultimately, I think what that's going to do is cost the community more money and resources. People will be sick. People will be going to the emergency rooms, in and out of the jail systems. And I think it's a very real issue for us, because if we don't move past it, it's very hard to create new services. It's very hard to utilize the services that we already have.
Sort of, yes, that happens, and
Yes.
this is what also happens. And
Yes.
so, yeah, okay.
I think one of the
Yeah.
challenges which is being faced right now in this meeting here is getting the right players in the room. So, because the solution isn't one entity.
Right.
It's not just governmental. It's not just business.
Right.
It's not just community members. It's not just the faith community. It's everyone playing their part. And so conversations is a huge challenge to overcome. Communication is a huge challenge to overcome. Getting all those entities to work together for a common solution is big. But that's happening. I've seen a lot of people come together in recent months talking, and this is a result of
Yeah.
some of those talks, is this meeting here. So if that can grow and people can start talking the same lingo, using the same terminology, finding common ground amongst all people, then it can be chipped away at.
Just in addition to that, I was going to say, I think, we are expanding the conversation within Fort Collins, but I think we also do need to expand the conversation and the partnerships to the entire region. Loveland not having a permanent shelter, we do see a fair number of people who become homeless in Loveland and need to move up to Fort Collins because there really are very limited services down there. So not only do we need to create partnerships within Fort Collins, but really partnerships within the community. I think another thing that would help with those conversations is just improved data. I'm a bit of a data wonk, and I just always want to kind of see the numbers. And homelessness is such a complex issue. I mean, I've worked with people who had as little as a second grade education who are homeless, and people who have PhDs and are homeless. People who became homeless because of economic reasons, and people who became homeless because of a medical or mental health disability. So it's such a complex issue that I think the more data we can collect, the easier it's going to be for us to really have targeted solutions, because a one-size-fits-all solution for homelessness is just not going to work, because it's such a complex issue.
Right.
And I would follow that up by saying that I feel like both what Ryan and Zach said is very important to collect the data and to continue informing the general public. We have a lot of forums where that's available, and I think it's really great that we have a couple hundred people coming today, but we need to get the information out to the general public and inform them on how they can make a difference every day with these people, and educating them that homelessness just is not a character flaw, but it's a circumstance. Hopefully it's not a permanent thing, and a lot of people think that there's just a quick fix, and there's not. And so bringing everybody together and extending the communication and the education on that is vital.
Any challenges you would say, Todd?
No challenges. I'm actually quite happy with that foundation that my fishbowl companions have laid out. I would agree that the resource coordination is going to be there won't be the success without that coordination. And second, the data integrity, to solidify that a little bit so that it's quite solid, and then a really good data interpretation. And then that, as Jean mentioned, that's the product that you can then educate the community with. That's my summary.
Okay. Any other comments around challenges? That was pretty easy, actually. So let me ask something else. So what is one thing, based on where you sit and what you see, that can be done in the next year to help make a difference and help make homelessness short-term and all of that, and not a long-term situation for people?
I'll throw out one idea right away, and I think this one is actually relatively easy. There's a lot of wonderful service providers here in the room that all do great deeds for our community. I think we do have a challenge periodically, though, that when we identify a homeless person in the field, especially the first time they're in our community, that we aren't able to actually triage to what their needs are. Because I think each homeless person may have slightly different needs.
Sure.
And I think if we collectively, meaning all the service providers, our police department, City of Fort Collins, and others, can identify exactly what those lists of services are, that we can match them with the individual homeless person's needs on a regular, recurring basis in a consistent fashion, then we can make sure that we get them to the service that they need. Again, it's not always about just making sure they get shelter, it's about getting them the services and counseling to get them out of that loop. So I think that triage component is something that we can do collaboratively very quickly.
Is Fort Collins engaged in discussions around coordinated assessment? Yeah.
Yeah. And that's, part of what, the Murphy Center has worked on is, trying to be that central point of intake, trying to do that coordinated assessment. The community's created a self-sufficiency matrix so that we can kind of assess what people's needs are in, I think, 13 different domains. So that definitely does help significantly in terms of making sure we're connecting people with the right services, because it's a waste of resources to connect somebody with a service they don't need, and it doesn't help anybody if we don't get them connected with the service that they do indeed need.
Right. Okay, thanks.
And I think just as an extension of what Jeff said, I think I think that's a great point. Better coordination between the different stakeholders that are involved in the issue of homelessness. And actually, it's one of the things that's been most encouraging for me in the last year. I think we've seen a lot more coordination between service providers, between the city, between the police department. And eventually, I think our hope is to get to a point where, like you say, we see a person who's experiencing homelessness on the street, whether it's the police who engage with that person first, whether it's our street outreach program, or whether it's the Murphy Center, or whoever it is, that we have the means to get that person to the resources that they need quickly and efficiently.
Though I do think, in addition, obviously we need the actual resources to then connect them with.
Right.
We've had a housing work group going for probably close to a year now, and the original idea of that group was to make sure we're connecting people with the most appropriate housing for them. Mm-hmm. So somebody who just needs a little bit of assistance from Homeless Gear with getting a job and then ultimately getting their own apartment really shouldn't be in permanent supportive housing. Taking up a spot that somebody who actually has significant mental health and substance abuse issues might need. But the issue is that with so few resources, it becomes really difficult. We'd have those meetings, we would talk about, well, this person really would be perfect for permanent supportive housing. We don't have permanent supportive housing, so that doesn't really do us a whole lot of good. So I think in addition to coordinating and trying to make sure we're getting people connected with the right resources, we have to then make sure that those resources actually exist for them.
Mm-hmm. The problem is getting them all linked together in conversation like this. Because one person knows one thing and the other person's like, well, where's that? We don't have that. It's hard to find that adequate. I had lived at a single room occupancy over off of Myrtle for 6 years, until it took me 6 years to get my voucher, my Section 8 voucher. 6 years. There's people out there now are getting turned away for Section 8 vouchers because they got it closed. I've seen families coming and going out of that mission, and I don't know where they're gone. Children being sent out in the cold. I think that's, we need to do something.
Well, I think to go with,
Yeah.
at some point you can, like you've said, a bunch of people have said now, you can align the resources perfectly and have a streamlined system to get people to the end. But if there's no housing at the end of that line, there's really nothing you can do ultimately. That's not really I guess that's not a 1 year
That's
solution.
not a 1 year
It's like
That's a
the
long-term
the women
strategy
now,
for sure.
they got a shelter for the women in overflow, but they can't go there until like 10 at night. So where do they go to stay warm between those hours? I used to go sit up at McDonald's and hang out there when I was in the overflow. You can't sleep there. And then when you're out in the cold, you go to find a place that's open 24 hours, like Walmart's, and you walk around and you walk around. Library, you go sit there at the library. We need something permanent during the day. We had the day shelter, but they still kick us out like for an hour in the evening if you're a resident. But if you're not a resident, you're out on the street, out in the cold. Right now with the snow today, it's like, and there's babies out there. It scares me. Yeah. That's how I feel.
Sure. So you bring up a really good point. Obviously housing is the answer. Housing is a long-term answer. Are there actions or things that can happen more in the short term to help alleviate the issues that people who are outside are facing that would eventually lead to permanent solutions? Or there are some, but it's not enough, or,
Well, I think just because something's a long-term solution doesn't mean we can't focus on it in the short term. There are
For
things
sure.
that we can do in the short term to get us into a position where housing becomes a feasible option years down the road. And in the meantime, I think what we need to continue to do is align our services in such a way, improve our coordination as a city in such a way that when we have that final step in place, people are going to be quickly placed into housing. They're going to go quickly from step A to step B to step C all the way till the end. So I don't think it's one or the other. I think it's something that we we do simultaneously. And I am encouraged. I mean, there have been a lot of things that have happened in the last year, not the least of which is this coordinated intake assessment that the Murphy Center really spearheaded the development of, to make sure that we're all on the same page when it comes to assessing people's needs, directing them to the right services, and getting them on that path towards self-sufficiency.
And do you have regular meetings where, as providers, you get together and talk about what's going on?
We do,
Yeah.
yes.
Okay.
Yeah, Vanessa has sort of spearheaded that, but we meet at least once a month.
Okay.
I see him more than once a month.
Once a day.
Too much.
Obviously, I'm biased since I'm going to be overseeing red tail ponds. But, I mean, I do think permanent supportive housing is a really key component of what we need to do in this community, because we've seen time and time again that, somebody who has really complex needs, it's not enough to simply hand them a set of keys and say good luck and walk away. You need to continue to provide them with support and the services to help them address the issues that led to them becoming homeless in the first place. And we do have red tail ponds that'll be opening up soon, but that's just a drop in the bucket of what we ultimately need. And I think it may sound like it's a long-term solution, but really if we can continue to develop permanent supportive housing on a regular basis, not every 5 to 10 years, but every 2 to 4 years, then we can actually get ahead of the curve at some point instead of constantly playing catch up. I mean, if some of the estimates of us having an increase in our population by 50% over the next 10 years occurs, then really we're just going to be continuing to play catch up if we just stay on our current path. We really need to actually escalate how quickly we're developing these projects.
So Ryan or Todd, is there anything you want to offer to this conversation?
As a business community in
Yeah.
Old Town, we've been coming together and sort of defining what are behaviors that are acceptable, no matter if a person's homeless or not.
Right.
That the whole community sees, like that behaviors that are going on in Jefferson Park or on the corners of downtown Old Town Fort Collins. And I think that's part and parcel. Part of the answer.
Right.
You see the comments on the Coloradoan, you see the divisiveness of what people perceive as homelessness and what they see in terms of bad behaviors they see versus the lower part of that iceberg,
Yeah.
which is the problem, and that is being addressed by all these service agencies. So it is still, I sort of fall back to public perception on behaviors they see versus actual issues that are out there and that are being addressed, and making sure that the two are as close as possible to reality. So I think it would be good to define good and bad behaviors that are acceptable as us as a general population, and that are enforceable by the police, at the same time not making homelessness a crime.
Right.
So it's like that has to be agreed upon and set, because that small tip of the iceberg image that is out there will determine a lot of the direction of where funding goes. So therefore, one of the small intermediate challenges of this group or others should be proper public perception of the issues, as well as coming together and defining what are some behaviors that are unacceptable to all of us, that are exhibited by people, not just homeless, but people in Old Town or in other visible areas of Fort Collins.
Yeah.
Yeah, I can't agree more with Ryan. A large majority of my work, of course, is based upon people's behaviors, and in establishing appropriate behaviors and addressing those is in part that empowers the community. It empowers agencies, police agencies like mine, merchants, business owners like Ryan, and other service providers. When the definitions are established, the accountability is established. So a shared responsibility, a shared accountability is critical to any sort of success.
So there's a point where there may have to be police intervention.
Certainly.
But there's also points where other people can intervene based on people's behavior, so it doesn't have to go like at the library, and sometimes, depending on where that person is coming from, it may even be more appropriate to not necessarily start with a police response, but maybe start with another response, and see how that goes. So is that something that exists in Fort Collins, or is that something that
We have
is
some.
it sort of?
We do have some very good examples
Okay.
of the existence. As an example, Gene and the library district has created what I think is called a users policy, and the patrons of the library have an expectation to abide by the criteria, and then of course if that users policy is breached or something brings attention to staff or anyone else, then that person can be contacted and say, hey, you were breaching the users policy,
Right.
So here are your consequences. And they're certainly not unreasonable, and there's opportunity for people to reconcile or get warnings or whichever. And that's a fine example and a great template for other places like at the library, rec centers, or whatever, public assembly areas, high usage areas, places like Old Town Square. But by establishing that, it's a behavior policy. It's a
Right.
usage policy. It's about politeness and civility and things. And we've had some great success. The primary example I like to use is the library downtown. And the word is out. It doesn't matter if you have a home or not. The message is there. If you're a young person, a student, you have a home and a family, and your behaviors are negative in that environment, then you're probably going to leave for the day or have some other kinds of consequences. So it's a great example. It's a great template that I've used over and over to allow other people just to explore some opportunity for change, and whatever environment that they control.
Todd's been very helpful with that, and other police officers as well, in terms of creating that document and helping us enforce it. And it's because the library's mission is to create a safe and welcoming environment for everybody, regardless of who the users are. I wanted to add in too that I think one of the things that our community could focus on a little more in the short term would be some of the, maybe extending some of the homeless prevention initiatives that we have. We have some very good ones, but kind of along with the education piece, the more that we do to prevent the homelessness and the more of our efforts we can put towards that, then people don't even get there.
Right.
And I think our point-in-time statistics show that folks like to stay around where they're comfortable,
Right.
and they do, and so maybe if we can help them keep a home, that would be a significant thing to do too.
It's also significantly cheaper for the
Right.
community
Yes,
if
it
we can
is.
keep them housed, and
Yes.
significantly less traumatic for the person,
Yes,
instead of them
definitely.
having to become homeless and losing all their belongings.
Yep.
You know,
I
the
lost all my everything.
The other thing I think that the library has done a great job of is not only coordinating with the police, but also engaging with Touchstone Health Partners so that there's actually mental health outreach. So it's not just simply saying, you need to leave the library and you can't ever come back again, but, that there's some underlying issues here, and we have, people who come and do outreach who can maybe help you address some of those issues so that we can address the behaviors long term, not just the behaviors in this location and then those behaviors move to a different location and then to a different location, but really being able to address the underlying cause.
And the nice thing about it is that it's a service that anyone can come and partake in, and that's kind of how we design our services and our partnerships. So if there's anybody in the group that I'm missing, see me later, because we would love to do more and to partner more, because we have enjoyed some very rich partnerships and it's helped a lot of people, but there's more work to be done.
Can I just add something
Yeah, for sure.
to what Todd was saying? I think one of the, and actually to what Ryan was saying as well, the Downtown Development Authority actually recently convened a meeting of, I think, several of us here were in that meeting to talk about some of those behavioral issues downtown. And what I appreciated about that discussion was, I think Matt and Derek from the DDA brought a lot of nuance to that discussion. It's not just it wasn't accusatory. It wasn't like they were coming in and saying, we have homeless people downtown who are causing problems and we need to do something about it. It was, we have behavioral concerns downtown. Some of these relate to people experiencing homelessness. It's by no means everyone experiencing homelessness, but what can we do to address that issue? And I think the more we can bring those stakeholders together to come up with creative solutions, because I don't think anyone wants our downtown to be a place where, you know, some of these behavioral issues that we've heard about are happening all of the time. But at the same time, we don't want to cross over into, I don't think anyone wants to cross over into that line where we're criminalizing not just behavior, but actually being homeless. And so I appreciate the nuance that's been brought to that discussion in the last couple of months.
And to highlight part of that discussion, one of its outcomes, one of the biggest bad behaviors we see in Old Town is public drunkenness.
Right.
And that has, next to, you know, it's very little is contributed by homeless population. It's mostly the general public. So that and you know, public urination and those types of things which follow public drunkenness are being had by the common, I wouldn't say common, but the rowdy individual down there, and later at night. And so it was nice to have a conversation just about behavior and not necessarily, you know, trying to identify every people group as part of the behavior, because that's where we were getting at with that discussion.
Stereotype. That's stereotype.
Right.
That's right.
And where we had a lot of agreement too, because I think we can all agree there are certain things that we don't want to see.
Nobody really wants to see all
Yeah.
that.
Right.
Is there a public inebriate pickup program here? No? Okay, it's police who do that?
No, I answered too soon. There are services that are available, and they're usually during the weekend hours downtown.
Okay.
In that sort of the nightclub environment.
Right.
So there's lots of opportunities there, but it's localized.
Okay.
And it has more or less a defined demographic. It's the patron of the clubs and things like that. The university's involved in that.
Okay.
The city bus system is involved in that.
Okay.
So the public transportation is involved.
Okay.
And it's usually when the college is in session. Sure.
And then of course,
Yeah.
you know, the cabs for hire, the limousine services,
Okay.
pedicabs and the like.
Yeah, I was thinking more, so Portland has this program, it's called CHEERS, Chronic Homeless Inebriate Emergency Response System. And it is run by a nonprofit. And basically you can call CHEERS anytime you see somebody, and they may be in danger, you know, they may be in danger of overdose, they may be in danger of themselves or somebody else as well. And the interesting thing about Oregon, though, is that if you get picked up, it doesn't necessarily go on your record because it's not against the law to be publicly inebriated in Oregon. So it's really for those folks who are, you know, long-term outside and are suffering from an addiction, it's a way for them to be safe and not add to their record. And I'm just wondering if that's...
So presently, it is not
Okay.
a crime to be intoxicated publicly or anything.
Okay.
We don't have a public intox
Yeah.
ordinance, and we don't have that service.
Yeah.
The closest thing to that is an ambulance.
Okay.
So if somebody is observed
Yeah.
in a poor state, we're usually contacted,
Yeah.
you know, the 911 center, and then they would dispatch a medical resource and likely a police
Right.
resource to do a quick assessment. But presently, it's a ambulance.
Yeah.
And we don't even have a detox in Larimer County, so if somebody goes to the hospital and they determine, I mean, the emergency room is probably the closest to the detox, and then if they truly need detox, then they have to figure out a way to transport them all the way over to Weld County for them to actually get into a detox program.
Wow.
If there's room in Greeley.
Yeah,
Yeah.
if there's room in Greeley, which
Yeah.
often there isn't.
Yeah. So that's a community need as well.
Yeah.
Yeah. Interesting. Okay. I want to, let's see, how much time do we have here? Oh, we're doing really good. So I want to jump back to the permanent supportive housing that's coming online. And you talked about doing some coordinated assessment work and coordinated intake work. Do you have a process by which you prioritize more vulnerable people for permanent supportive housing versus people who might need permanent supportive housing, but there are people who have higher needs that you should really prioritize to get into that housing? Does that exist?
Yes and no. So, you know, the Fort Collins has done a vulnerability index. a couple of times now. So we have done a vulnerability index, which kind of
Okay,
determines
all right.
Somebody's essentially their risk of dying
Yes.
on the street. In addition, we have just worked really closely with partner providers, so the Veterans Administration and Touchstone Health Partners and Catholic Charities, to kind of help educate them on what is kind of the ideal person for permanent supportive housing, and then rely on them to make appropriate referrals with preference points for those referring agencies, so that the people that they determine have the greatest need have the greatest likelihood of actually getting into the
Good.
program.
Okay. All right. That's good. I've done work in a number of communities where they've created a lot of permanent supportive housing, but not a lot of people needed that permanent supportive housing that went in. And so now some communities are even thinking about how do we move people on, and so we can really open it up for more vulnerable people. So it's really, I think it's really important. We didn't always think about that before. We were like, oh, permanent supportive housing, and it was still kind of a first come, first served instead of the appropriate triage and the appropriate intervention for folks.
Yeah, I think that's something we've been definitely careful about because, in the past, with programs like single room occupancy and other housing programs like that, there's just such a desperate need for housing that, spot would become available and case managers or therapists would refer everybody that they had that was homeless because they just wanted the person to have a roof over their head. But unfortunately that did lead to a lot of people who maybe weren't appropriate for that specific type of housing ending up in that housing. So
Right.
we're trying to do things a little bit differently now.
Sure. I think we're all learning from it. Yeah. So I'm gonna not the last question, second to last question. Actually, it is the last question. Sorry. So what is the next step for Fort Collins? Like the next step, not obviously investing in housing, having community dialogue, talking about the need for detox, whatever it may be, but what is the one next step for Fort Collins, and where should the accountability for that step lie?
I'll take a stab at that. I
Sure.
think this is the number one next step, is having this conversation when we're having
Right.
this afternoon. But after that, it's really identifying what additional work needs to be done, and then more importantly, who's responsible for that work. I think every one of us in the fishbowl today said homelessness is a community issue. It's not the government's issue, it's not a business issue, it's not a service provider issue, it's all of our issue together. We have to identify those interventions and services and housing alternatives, and then decide collectively who's responsible and accountable for them.
Right.
Integrate that into our 10-year plan, and then go forward. I think we spent a fair amount of time over the past year talking about behaviors and talking about different enforcement and things of that nature. And to me, we're just nibbling around the edges.
Yeah.
We're not taking the problem on head on, and we need to do that. So I think our next step is what can we specifically do, who's accountable for it, and then equally important, how do we measure it to make sure we're going in the right direction.
So anyone want to dig in and figure out what it is we should do, who should do it, and how do we measure it?
I nominate Todd.
Quite honestly, I mean, as Jeff alluded, this is going to be, perhaps there would be a focal point to the accountability, but this is a very shared responsibility
It is.
amongst our government, our resources, our community, even to the point when we discussed earlier about our community members voicing, speaking up, standing up, and kind of defining what those socially acceptable behaviors. That's an amount of responsibility. So I think my first endeavor might be to begin to more finely coordinate the resources, because there are a lot of resources, whether you're a professional or not. There's a lot of energy that is compassionate and empathetic to people that have needs, and to finely tune that into that usable energy, and to delegate some accountability. There may be for a good amount of time, and even today, the Murphy Center has been a hub That's where the answer was to everything was to the Murphy Center. And Zach and his staff did a marvelous job in doing that. But it wasn't a remedy, it wasn't a cure or anything else. It was where we did send a lot of folks. But then there were some that weren't able to use services, didn't want services and things. So it wasn't, it certainly wasn't 100%. I think I just want to reinforce how the accountability is very much shared. And if this community, if Fort Collins, this group, this audience takes this topic seriously, then there's a bit of ownership with everybody.
I think that's, yeah, having that mutual accountability is really important. It's much better than, oh, the city should do it, oh, the housing authority should do it, oh,
so the actual
library,
formulas and some things, I can't even pretend to say that I have those.
Right, but
but it needs to be heard.
Right.
This is a shared responsibility.
Okay.
If I could add again, I'm
Yeah.
sorry to jump in again, but I think
No.
it's important for us also to do a gaps analysis more than
Okay.
anything else. I think we have a pretty good mission of what the city of Fort Collins is planning on doing short and long term. I'm pretty sure Homeless Care knows what they're going to do, Murphy Center, et cetera. I think it's important for us to all get together and talk about what our plan, what our services are. I'm confident that there's gaps in there. Unfortunately, there are gaps in there.
Sure.
And then we identify what those gaps are and just say, okay, who can step up and help fill that gap? How can we do it collectively? So that is a really important part of our charge, and we need to do that quickly.
Okay.
I think I think the question is a really, really difficult question, because I think the issue is it's almost too complex to say this is the one thing we should be working on and this is who's accountable for it. I mean, and I also don't want to diminish the fact that there are already great things happening in our community to address this, to address the issue of homelessness. So, it really is a little bit of everything. I mean, I agree. There are gaps in our community, and really the only way we're going to discover what those gaps are is if everyone comes together and figures out what those gaps are. Because there might be something that you think is a gap or I think is a gap, and then I find out, oh no, they're doing that over at the housing authority already.
Okay.
So I think it really is a combination of streamlining our services in the short term so that the experience of being homeless can ultimately be rare, short-lived, non-recurring. And then at the same time, I think it's developing the housing options so that when people get to the point where they're ready to move into housing, the housing is there. I wish there was a silver bullet, just an answer that would answer everything, but I don't think that answer exists. I think it really requires us as a community to come together and do a little bit of everything, and that'll add up to a big solution.
Worked at HP for 9 years as a computer engineer, and we had a design theory called contextual design, and it's where you step through every user's scenario. Like, okay, the student steps on campus and goes to their math class, and then they go to this class, and you'd see that in a common oval, that there'd be cow paths that would form completely opposite of where the sidewalks are. Right, and we all understand that, and so the smartest solution is develop sidewalks where the cow paths are. So anyway, I say that to say it would behoove us to get the right players in the room, the leaders of certain organizations and service industries, and go through that, right? It's probably a gaps analysis, but with a group, a mindset, and find out who's treating what. Maybe there's services that are doubled up and being done in multiple different areas that maybe could be streamlined and put into one area, and therefore have the resources available to fill in those gaps. But that exercise of getting the right players in the room and then walking through actual scenarios, right, with different homeless types, right, those that are described on the board, and then walking through what is a day in the life of this person, what is the day in the life of this type of person, and walking through those day in the life scenarios and seeing where the gaps.
Building the sidewalks where they should be.
Yeah, building the sidewalks where they should
Where
be,
they look
making
pretty.
more use of our concrete.
Got it.
And I think relying on national experts and what's going on in other places, I mean, there really is some amazing, innovative work that's being done in other communities. You know, places like Salt Lake City, where they've been able to reduce chronic homelessness by 70%. You know, states like, I believe it's Arizona that, or maybe it wasn't Arizona, but I know there was a state just recently that just housed their last homeless veteran. So they've completely eliminated veteran homelessness in their state. So I mean, there obviously are solutions out there, and I think that we need to look at every possible solution and see what works well for our specific community, because there are unique things about our community, and what works in New Orleans isn't necessarily going to work here, but I think there's a lot of lessons that we can learn from other communities.
Yeah. We're kind of at time, so any final comments, Jean or Susan?
No.
No? Okay. All right. Well, that's a lot to chew on. Okay. I want to thank you all very much. It's not easy to sit in the center of a room and have everybody stare at your backs while you talk about this stuff. So just to keep in mind, we really want to hear from one person at a time, and once you've spoken, you've gotten your chance to speak. If you did not get a chance to speak today and you want to share something, come to Vanessa or I, and we'll take your comments in as we can after it's over with, because there's a lot of people in the room, but we want to make sure we get through as many people as possible. So I want you to think about what you heard, anything you want to reflect on that, or anything you just want to, you've been dying to say while you've been listening to these folks.
Hi, I'm Bruce with the Food Bank for Larimer County, and going back to what Zach mentioned early, our statistics show we're in it for hunger relief. Homeless folks many times access our services. We served about 850 folks that identified themselves as homeless last year out of 29,000 unduplicated clients at the food bank, and really keeping it a regional or county-wide conversation, as I think Zach brought up earlier. It's a situation and it exists in the entire county, therefore partners even over to Weld County, but certainly down to Loveland, even up to Estes, Wellington, making sure we're pulling in all the resources as we develop a solution for the entire region. If we can nail it in Fort Collins, perhaps we can share that with the rest of our neighbors. So thanks for the good work and the feedback in the center of the fishbowl.
Joe Rowan, Director of Funding Partners. I'd maybe add two things that are the biggest challenges, and I would say expectations and courage. So I think if there's anything that we can celebrate, it's the opening of the Red Tail Ponds project, but in a way it actually is a disservice because what it does is it sets an unrealistic expectation that we're going to be able to replicate that project. The resources that we had that were utilized for that are extremely finite, and we may be lucky to get another project like that in the next 10 years. So what we have to do, I think, is temper our expectations, and this is both from a public policy standpoint, from a practitioner standpoint, that when we develop these units, they aren't going to look like every other apartment project in town. They're not going to be able to be, we're not going to be able to make them in such a way that, or build them in such a way that it's something that we would all be proud to live in. I think what we have to recognize is the expectation that what we're trying to do is create safe, decent housing that's proximate to the population that it's serving, that it provides the necessary resources, but it isn't necessarily going to be a Class A product that is indistinguishable from any other multifamily property in the community. And I think what that's going to require is a lot of courage. It's going to take courage from the public policy standpoint, that we're not creating standards that are unrealistic. And it's also going to be courage as a community member that these are our neighbors and they're going to live next to you. And so I think that from that standpoint, we do have to push back when there is we support the idea of helping folks that are needing help, but we just don't want them next to us because that's going to ruin our property value. And so we have to have the courage to say BS. That isn't what happens. We know it doesn't happen, and again, we just have to have the courage to stand up and really address the problem.
I'm Julie Bruin. I'm the CEO of the Fort Collins Housing Authority. And Red Tail Ponds is a very unique and special permanent supportive housing site. My team went all over the country and looked at best practices. But permanent supportive housing in that form is not for everyone. We have to look at other options: rapid rehousing, short-term assistance, really strong wraparound case management, triage in emergency situations. So I'm hoping we can have more conversation about what rapid rehousing is, how that fits into our gaps analysis. I also serve on the Homeward 2020 board, and we have engaged the Corporation for Supportive Housing to update a services map or gaps analysis. So I think that will be helpful as well. We started to identify the number of folks in our community who would be most suited or needing this type of permanent supportive housing. And while we still do have needs for another maybe 100 or 200 units, we have a bigger need in our community for the things that we're talking about: affordable housing in general, rapid rehousing, short-term rent assistance, job training, employment counseling. So it's really starts to feel a little overwhelming if we can chunk it out. And I would ask if anybody has something to add about rapid rehousing.
Good morning. My name is John McKay, and I direct the Homeless McKinney-Vento program for Poudre School District. So we kind of are the face of a lot of homeless students. Last year we had over 1,000 students identified in PSD. And so I think what we would like to bring to the conversation is how do we provide continuity of educational services for kids when we are experiencing homelessness in increased numbers. And we also see that we have a certain population of homeless students that are undocumented that don't always qualify for some of the services that our community has to offer. So we have anywhere from 58 to 81 different languages represented in PSD, and over 2,000 English language learners or linguistically diverse students and families that are represented in Poudre School District as well. So when we talk about a comprehensive approach and connecting the dots within our community, I think it would be worthwhile to think about how McKinney-Vento services can be coordinated with our organizations in the community to provide consistency in transportation. Sometimes it does take us up to 2 weeks, sometimes even 3 weeks to be able to arrange the transportation. So knowing that you have affordable housing or some housing that's going to be developed on the southern end, it would be important for us to try to understand what are the bus routes necessary to provide quick response to our families so that they can continue their education in their neighborhood schools, or if we do have to relocate, how can we make that a sustainable transition so that we don't have to transition and transition and transition. Yes. And we do see a lot of families coming from Loveland and even from Greeley because we are rich in services here, but we are not rich in affordable housing. So they get back on their feet and then they transition out. And so what we do under continuity of educational services with McKinney-Vento is see how we can partner with the district that they move into to see how we can continue to provide transportation for the duration of that year. But there's a lot of federal compliance components that a lot of you deal with as well, and I'd love to be able to have a conversation with you so we can start connecting the dots.
So that's one more piece of the coordination that needs to come in is the school services from under McKinney-Vento.
I was delighted to hear you bring that up. You know, I'm going in a different direction on this, focusing here. We have 200, the number says 289 homeless. My concern is that that number does not become 500. So I would like to see the conversation move into how do we stop from the bottom up? And one of the pieces starts, I think, with school district, and the other conversation is with the medical services. If these are one of the root causes, mental, physical disability, moving into homeless, they are the first persons to become aware that this is the next person moving into the system. It's true in the school district, and you know what happens with families, and those are the next ones moving out. How do we coordinate that to make sure that the groups within the school district aren't the next ones sitting in the homeless shelter or sitting in their cars in parking lots? And I don't know how we coordinate that, but it is the first line to moving up that program that isn't starting with, it starts with 0. And that's where I don't know how we coordinate that, but I think it has to happen. And the third piece, as you've mentioned, is jobs employment. And if we don't have a conversation about that as well, I don't think we can reach our goals of making it permanent and non-reoccurring, because it's root causes, and I'd like to see us looking at that as a community.
My name's Randy Mergler, and I've lived here since '77, most of the time up in the foothills, but now I'm a townie. I think something that we can look at that's very doable is tiny homes, creating tiny home communities. Utah, I believe, somebody mentioned that already, has almost wiped out homelessness, and I think part of that is tiny home communities. Portland, I know, is one of the towns that's been doing a lot with that. Madison, Wisconsin, Austin, Texas. There are places all around our country that are already sort of setting the pace for us. I think what we need to do is look at properties that are available. There are a number of properties that are available close to town or in town that are sitting there, but probably money is the big problem there. Developers are waiting to make the most money on those pieces of property. So this gentleman over here, I think, mentioned courage. And I think we need to have some courage. I think we need to be forward-thinking, visionary, and look at things like that. If we had in-town tiny home communities, they could be a model for other places around the country, around the state, and they would be close to services, like we're talking about this morning. And I'm very eager to talk about that, to continue that conversation with people. I've got friends, met with Bruce Hendy a couple of weeks ago with a friend of mine that's real interested in doing it with container, building tiny homes out of containers. Been researching this for a couple of years now and I'd love to have more conversation about that. Thanks.
Yes.
My name is Olga Duval. I'm with the Family Center La Familia. And Julie Bruin was talking about rapid rehousing. One of the examples that we have in our community is the program that was started recently by Homeless Gear, One Village, One Family. And this is another example of how the whole community on all levels can be involved in the conversation about homelessness. So the example is the program involves the groups, the teams, the villages from the community, from the businesses, from the faith groups, from neighborhoods. And these villages are supporting one homeless family at a time, counseling them, creating the connections for that family, creating the friendship, relationships, support, and thus allowing the family to move into the permanent housing rapidly and being successful there and being able to stay there. So just one of the examples of how we can work together as a community.
Hi, I'm Allison Dawson, and I just had a couple comments. One was that when people were talking, they were talking about permanent supportive housing and then housing that's available for people that maybe work. And for one thing, we don't have a living wage. We can't afford rent right now. If you have a full-time job and are working minimum wage, you can't afford rent in Fort Collins. But the thing I wanted to address is that there just isn't enough housing for people with disabilities that can't work. And they might not necessarily fit into something like the Red Tail Ponds model because they're fairly stable. They don't really need that kind of intensive support. And then as far as getting to root causes, I feel like especially people with mental illness, there just needs to be a whole lot more support in our community, a lot more vocational support, helping people actually, instead of their goal being getting disability, their goal being getting disability and also working. And there needs to be more housing models available for people, particularly young people with mental health issues that maybe wouldn't fit into a Red Tail Ponds type of thing, but can't quite, can't work. And there just is a real lack of housing. And like Zach said, sometimes you can get people, along the path and give them all these support services, but at the end, where's the housing? There just isn't any. So that's.
I'm Jerry Horak. I'm on the Fort Collins Council. One of the things that's really occurred to me over the last few years, and I've tried to really work on with other council members, is transit service, and really looking at that to make sure, and our folks in transit do the research, but really looking at that. you know, we could always go into social services, we could try to provide all sorts of housing, but one thing we do is provide transit, so that's something I know we can do well. So that's one of the focus we have, and we spend, like, as a community, $13 million a year on that particular service. To go up to a level which many of the community would like us to see is about $20 million a year. So when you're talking about courage, there also has to be courage on just providing the services so folks can go from wherever they have a house to somewhere else, because lots of folks are homeless, or lots of low-income folks don't have vehicles to be able to do that, and the whole idea is not to have people to use their vehicles as much. Along with that, we've made sure as a council that we have instructed the city manager to give out as many transport passes as needed to different social service agencies, so the homeless and others can easily get from here to there.
My name's Wesley Alonzo. I've been in Fort Collins for 16 years. And I guess two things, as I believe you mentioned earlier, gaps in our system is our minimum wage. I believe to afford average housing or living expenses in the city, or minimum living expenses, you have to be making somewhere around $12+ an hour, 32 hours a week plus benefits, which is not our minimum wage. And then another thing that I know that I see as an issue, and a lot of people that I talk with see as an issue, is our housing occupancy law. The U+2 housing occupancy law, to me it seems like a blanket law that tries to prevent too many parked cars and noise violations, and I don't think it always achieves that effect, and it also prevents people who are maybe living in 6-bedroom homes from actually putting people in those homes. And I imagine if we only have 289 people that, like, assuming that number is correct, in the city that aren't currently housed, that they could fit in many of those homes.
Yeah.
Anyway, that's all I have for now.
Okay. Well, the living wage is a really good one. It's obviously much more upstream than, you know, talking about direct homelessness, but Seattle just passed it. So, I mean, I think it is possible. It's interesting. And then behind me, so I'll move.
Hi, guys. I'm Tom Constanti, and I'm the Assistant Director for the Fort Collins Rescue Mission. I've been working with addicts and homeless people for about 12 years now. I just want to say, while I love a lot of this, I feel as though, again, we have these conversations, we have too many people coming from so many different angles that it's kind of hard. I feel like we're eating an elephant. I really do. Mm-hmm. Somebody over here is eating a trunk, somebody over here, and we feel like we're doing a whole lot, but there's a lack of consensus. What I would love to see is I would love to see a flow chart. I would love to see, I want to see that coordinated thing. I should see it. I deal with a good 100-some people of homeless people a day, and I've never seen that. I would love to see some consensus in the sense that we have a report card where we can say, these are our areas, we come together as a group, put it out there, this is what we're gonna do. And so we can say, yeah, we'll celebrate the transit. This is services, this is housing, this is the mental health, but we need something more than, as far as I'm concerned, this is what we're taking, but how well are we doing at it? Because it's really hard for us to sit here and say how well. We don't use the same language, and that is problematic to me. I think we all need to be on the same page, using the same language. I also think that not everybody needs to be speaking. I think we can start coordinating people to do the assessment and kind of push it towards those people. We can do people who streamline the resources so that we can, I don't know, I think sometimes when we get in these situations, we have a hard time coming to consensus because there are too many voices. And it's not that I don't want everybody to be heard, I just feel like when you try to address too many things at one time, you kind of get mixed up. Now, one thing I will say is, we're having a hard time with the homeless people because it's hard holding them accountable. I really feel like we need to come to a point where we can agree upon this is not a free service. There is some behavior, there's some accountability on your part that you have got to take a step over the tiniest little hurdle if you want these services. The problems that we have is housing is important, but I got to tell you, with my population, that's only addressing about 25% of those people. You put them in a house, they're still going to have mental health. issues. They're still going to have addiction issues. And while that may be the government thing, here's my call for, believe this or not, as an ordained chaplain, I want to know where the faith communities are at in this discussion. I would love to, you know, as a process engineer, I would love to have people who are in the business community take on, hey, we're going to do a mentorship program. We're going to train you for 6 months. If we don't want to hire you here, at least we have some consistency. So we have to have some pilot programs where we can take on maybe 2, 3, 10 people within the next year and see what does work. And that's what I'm interested in, the coordination. I'm just, from the other end where I'm working on the front lines, I don't quite see it, and I'm looking forward to that.
So a couple of things just to follow up with that. The coordination piece has come up several times, so I think that that's something that's been written down several times. So that's something that needs to be worked on. The making sure that people can stay in housing once they're placed in housing, which means wrapping them with the supportive services they need, no matter where they may be in their mental illness or addiction. And that's sort of what you said, but that's also what I heard from other folks. The one thing that I think was interesting, and I want to hear maybe from others, is this idea of benchmarking and having a performance report. And if there's maybe not this room, but a smaller group of people that come together and agree what, as a community, we agreed to be measured by, and then every month we figure out how we're doing towards hitting those goals, reducing the number of people sleeping outside, increasing the number of units, whatever that may be, that seems like a really interesting idea as well.
I'm Jessie Mae Hendrickson with the Larimer County Workforce Center, and I did get excited about the gap analysis because I think through that we'll be able to see opportunities that we're not equipped to handle, and that could be part of the strategic plan on figuring out how we as a community can become equipped to handle those opportunities. And we'll see opportunities that are there that we are equipped to handle. One of those things I think is our employment services organizations should come together in a coordinated effort and have some kind of employment matching that happens between the business communities and those that are unemployed at this time.
Just a couple things. Want to reiterate that a community mapping gap analysis is being done currently, and so that will be shared throughout with everyone. And I know some of you are familiar with that, but some aren't. And the other thing I would like to say is that in addition to homeless gear, helping people survive on the streets until they do have homes, and now sponsoring also One Family, One Village, and in addition the Hand Up, which is the mentoring program for people to re-enter the workforce. Mm-hmm. Another thing that they've done really quietly that isn't so visible, but just as important, is changing the social fabric of how homeless people are integrated back into the community. So their outreach program actually is about solidarity with homeless people and not an us-them. There are us and then there are homeless people. And I think that's a huge step in creating the social infrastructure to make homelessness rare, short-lived, and non-recurring. And I think that's something everyone in the room can do. And when people ask me, what can I do about homelessness, talk to them, say hello to them. When you see them on the streets, don't act like they're separate from we are, but from what everyone else in the community is, but treat them as the same that we would treat anyone else in the community, and just even say good morning or hello, and don't be worried about if they're going to panhandle or whatever. And it's amazing the response that you get. One homeless person said to me one time, I know they wish we were just behind a wall someplace where nobody could see us. And so to really reintegrate and make homelessness rare, short-lived, and non-recurring, I think it's a step that everybody can take. So thanks.
That relationship building is really important, even if it's just a simple one.
Yes, I just thought probably a lot of people have heard of faith, family, hospitality, but in terms of the hugeness of what everybody's talking about, it may not sound like a lot, but it is a faith-based thing. 18, 20 churches are involved, and it serves up to 4 families, I think, and 20 people, families and children. There are certain criteria to the program, and there is a paid employee who screens, and the people are moved by a van from church to church every week. The idea is to help these families get on their feet, get out in the community, find permanent housing, and so there is counseling and accountability along the way, but it's not a permanent solution, but
Right.
it is an interim solution. So.
That's a piece of the puzzle, yeah.
My name is Eddie Hopkins, and I'm not cutting someone off, am I?
No.
Okay. I'm a pastor at Peak Community Church, which is a downtown church, and I'm not speaking for the faith community, but from it. There's two things that I think will be helpful, that can be helpful from the faith community. One of them is confession and lament. We need to hear more of what was mentioned earlier about children being in the cold overnight. We need to hear more about ways that we have failed, frankly, and we need to be able to have space to repent and confess that we have failed. If we're taking community responsibility for the problem, we have to take responsibility for failures too. And the faith community is pretty good at confession, I think, because we don't leave it there. We take it somewhere, and it can actually be a very healing process and not just a depressing process. And so that's one area I think we can be helpful. The other area I think we can be helpful is talking more about the discipline of welcome and hospitality. And I don't mean like casseroles and tea and doilies, which all can be part of it, no doubt. But it is a discipline to welcome people who are different, welcome people who make us afraid of our own weakness and vulnerabilities. And that needs to be built up. And it hasn't really been, I would say, as someone who's been part of the faith community for as long as I can remember, it hasn't been a discipline that's been encouraged. And so I'm going to take that responsibility on myself to encourage that with my congregation and with my colleagues. And so I'm leaving with a sense of renewed purpose and responsibility. And so I'm really grateful for this group, especially what you said about what's happening to families. Those stories are really critical. So thank you very much for saying that.
Hi, I'm Kristen Powell. I'm the lead ranger for the Natural Areas Program, and I've been working for the city of Fort Collins for 17 years. I encounter homeless on a daily basis, or at least evidence of homeless on a daily basis, along with the other 6 rangers that work for me. And I just want to say, because I'm hearing a lot about homeless families, that we are not encountering homeless families camping in the natural areas and parks and along trails. That's not who we're encountering out there in our natural areas. So I just want you folks to understand that we're talking about a population of individuals sometimes that choose the lifestyle to live in the outdoors. And I see a lot of head nods, so I'm glad to be able to confirm that. And I'm not saying that we don't need to pour our resources into homeless individuals, but we need to focus our resources on the ones that want to move forward, and those individuals who live in our community and who are not traveling through our community. Thank you.
My name is Madeline Mim, and I'm a volunteer. I'm a volunteer with several homeless organizations around town, and I would like to add something to the suggestions for the living wage. I think we've talked about the elephant in the room. Somebody over here talked about the elephant in the room. I think the elephant in the room is really that wages are too low and apartments are too expensive. And the idea of a living wage, I think, needs to be expanded to a regional living wage. And I think that it should be unconscionable in a rich city like this that someone who works full-time year-round cannot afford an apartment. So I think that the regional living wage could possibly be based, I don't know the legal implications, but a regional living wage would be based on whatever is needed for someone who works full-time year-round to be able to afford the minimum apartment.
My name is Jake Sampson. I work for Encompass Technologies right downtown here. So we have a building on 420 Linden right off the river. You guys have probably noticed it. And we also have a building on Jefferson Street right next to the mission there. But really the point I want to bring forward is how the public needs to get involved, but unfortunately, I don't think the public knows the real problem. Including myself, just sitting here, hearing about the children, what's happened at the Poudre School District, these are all really important things that the public just doesn't really know about. The perception is the homeless folks are all, drifters, hanging out at Jefferson Park, smoking, doing whatever. And unfortunately, to get any public buy-in with taxes or any way of getting them to volunteer, got to get the right message out there and let people like myself actually understand what the real problem is with homeless families, children, and these sort of things. I mean, the perception all the way down to, I live in south of town, and they're putting in the new project down there. I literally saw bad emails going across the HOAs about how they're worried we're going to get the same drifters in our communities that we're getting there in Old Town. So anyhow, I think without doing some kind of press release or educating the public, I just don't know if you're going to get the the resources to move forward the way that you really need to. So I guess it's just a little input from the general public.
So I just want to add something to that. I think that, we talked a little bit earlier about the percentage of people that do possibly just move through town. But I think there is a population of folks that may appear to be drifters or may appear to not want services or may appear not to want to go into shelter that I think given the right opportunity and the right engagement could come inside. And I wouldn't say that if I haven't seen that. And prior to a couple of careers ago, I used to work for an agency and I worked with a lot of people in recovery. And a lot of the people that I worked with were people who had been on the streets for 20 plus years. And they came inside, and as a result of coming inside, were able to address their addictions and were able to address their health issues, and you wouldn't recognize them a year later. Now, part of that is relapse and things go in and out, and that's a whole nother discussion around addictions. But I do believe that there are responses for people who are out there that may appear to not want help. I think it's a matter of getting them at the right time and doing the right kind of engagement and providing a safe place where they can address their issues. So that's I just want to put that out there.
My name is Bonnie Insko, and I just wanted to add something about the potential for involving faith communities. I think there's a lot going on in individual congregations, and it would be great to coordinate those efforts. I'm aware of Faith Family Hospitality, and there are multiple churches involved in that. And I did one shift there, and so I went to their little training of the volunteers, and they said they had over 1,000 volunteers in the community that helps in this effort, and that effort only houses 4 families at a time. So it's great, but it's small. But I think there's a great untapped potential among faith communities. People are talking about this as a moral issue. And at my church, actually this coming Saturday at Foothills Unitarian, we are doing a workshop on poverty and community resources and how our congregation can get involved. And I just got the email from Serve 6.8, or the newsletter or something, and I see they're doing something similar in February. And I think using I don't know if there's anyone here from Interfaith Council, but I think there's great potential to get the word out through faith communities.
Wonderful, thank you.
My name is Brian Tribby. I am formerly homeless, and I'm on the board of directors of Homeward 2020. Whenever I come to an event like this, it fills me with a great deal of hope and trepidation, because it seems as though there's such a positive energy in this room right now, and there's so many people who want to do the right thing and to have a positive impact on the homeless. But it seems like we're all fighting one another at odds. And the one thing that I do want to say is that there is no them. It's only us. The homeless are part of this community. And having been homeless, and now I'm out of homelessness, I'm going to school. I hope to become a lawyer someday to fight for the homeless. But this group, you guys, there's so much energy, there's so much intelligence, there's so much money, there's so much creativity in this room that if we pull together, then we can overcome this. And one of the biggest problems of being homeless is you don't have a home. And if you have a home, I can tell you that your whole life will improve a great deal. Granted, there are other services that need to be happening, and there are supports that need to happen when you help a homeless person. But one of the critical things that I think that we could do that cost absolutely nothing is to treat these people with dignity and respect. If you walk up to a homeless person and say, hey, how you doing, man? You know, I may not understand exactly what's going on in your life, but you know, if I can help you in some way, you may have just saved this person's life. And I know this from experience because I have seen it happen. And I would challenge all of you today to change that one little thing in your life. Because if you can do that, you may save somebody's life.
Hi, I'm Sister Mary Alice Murphy, and have been in this struggle for a long time, and would encourage all of you to keep trying to do something instead of just, well, that was an interesting session we had, and not move on from there. Some little thing. I'm concerned about affordable housing continuum and the fact that the supportive housing is absolutely critical because it meets the needs of the most vulnerable and those that are the most willing to try to get out of that. But I think we need other affordable housing in this community, or it's going to become an elitist community that only the rich and the well-to-do and the intelligent can live. And all the everyday people are going to have to live outside. If we don't, and we need to start doing something about housing today, because it's not an easy thing to get affordable housing built. It needs to start today, and we need to have a concentrated effort on it, because if we don't, it's not going to be there. And we don't have that much land available. We really all have got to work together to do that. And the other thing I'd like to suggest is that we stay open to new ideas, because I heard something this morning I hadn't heard. And I've been doing this for over 20 years, that San Francisco had a lot of problems at their library with people coming and hanging out there, and a lot of problems. And I heard on the news last night, I think, that Boulder's having this problem, so it's in our backyard. And what they did was hire a social worker who works with the homeless people that are in the library and helps them to make connections with the resources that are available. And in turn, she has then hired some homeless people who are back on their feet to work in the libraries, to the point they've gone to branch libraries and they're helping to reach us. That's a creative solution.
Absolutely.
So if we can just keep our hearts and minds open to the different kinds of things that are available, it'll make it possible for us to start to nibble away at this elephant.
My name is Rick Bunch, in part representing Interfaith Council, but also Community of Christ, where we have been housing the Catholic Charities emergency shelter for women overnight. And because of the neighborhood meetings that we've had as a result of that, very much aware of misconception, misperception, outright fear and distrust. And so because of Interfaith Council, I think this would be a very good way for us to disseminate proper and accurate information to our various communities. The other thing is that Interfaith Council now has been in the process since our last meeting of organizing a task force which will address affordable housing, and among other things looking at the tiny houses, shared housing, and so forth. And then one final thing, it happened at one point in my life. I was director of Parks and Recreation in Oak Park, Illinois, and involved with community centers and so forth. And so the question was, what would it take to develop a day shelter, and perhaps even using some of our existing facilities, the community centers and libraries been mentioned and so forth. What would it take to develop a workable and affordable day shelter for the homeless?
Good morning. My name is John Barbieri. There's been so many things said that are amazing and incredible. I really appreciated the comment about, from the mayor about how do we focus our energy on preventive side. We do this in the health arena. We don't always apply it in the social issue arena. The other one about how we can all do something in terms of saying hello. But the third one is very interesting because I've heard it in different ways, which is we've talked a lot about consensus and shared responsibility and accountability. We've talked about a different kind of elephant. We've talked about the fact that we're going in many different directions in what's being expressed, and we have so many voices. And what seems to be missing is leadership. We have a mayor. We have county commissioners. We have a police commissioner. We have a director of social services. We have a director of workforce development. We have CEOs. We have executive directors of nonprofits. There's a hint there. But we don't have that here. So that how do we bring all of this energy, this incredible amount of energy and resources together, have focus and have a direction? I don't see where that leadership actually emerges that's strong enough or present enough, at least right now, that can do that kind of bringing it together and heading in a direction.
Does that make sense to other people, or is that, yeah? Because I'm seeing some nodding, and I just want to. One of the things that we've learned in doing this work in a number of places is that it's nice to have a champion, right? And that's good, but more importantly, you need somebody that I like to call the cat herder, or amoeba herder in some cases, whose job it is, because all of these leaders that are in the room, whether you come from the faith-based side, jurisdictional side, other community leaders, nonprofit leaders, there's day-to-day work that everybody has to do, that some of it touches homelessness, some of it is all about homelessness, but it's not necessarily about coordination. And so having that entity that can do that, and it seems that there's this this can happen with Homer 2020. And I don't want to speak out of turn or anything, but I just want to highlight the importance of having that organizing entity to make sure these conversations result in something that's implementable in the community. So, yeah, I think it's really important to have that. And it's really great that you raised that, because I kind of felt like it was something that was unsaid earlier, so I appreciate that.
One of the things that I've observed is that thinking about who might be missing and from the conversation. And we've talked about the importance of health. We've talked about the importance of jobs. We've talked about the importance of housing. And if there's anything I've learned working in government for over 30 years is that if we're not able as a community collaborating to solve issues, then we take it to the city council, we take it to the county commission, and then we have a lot of regulations. And so we've talked this morning, it's been mentioned a few times, about wages and housing and raising wages to a living wage and having housing that's affordable. So I think the challenge is to bring others into the conversation so that we look at solutions without having to resort to regulations that will, either say you have to have this kind of living wage or you have to have this kind of rent control or something like that. We are creative, we have a lot of resources here, and we can do that in a way that really is unique to our community and meets the needs without having a lot of regulations that may not really address the root causes.
I want to be respectful of your time this morning. I want to thank you all for your comments. I really appreciate that. So let's everybody get a... and then I'm going to pass it to Vanessa to wrap it up and talk about next steps.
Yeah, and I just wanted to quickly thank everybody for taking the time to be here today. Homer 2020, we really do want to step into that leadership role and in partnership with all of you, with all of the service providers, with our regional partners, with our government and business and faith communities, really be able to implement some of the ideas that we've started hearing pieces of today and that will flesh out in the next coming months. We are going to take all of the feedback that you've given today, the feedback that you provided when you registered online, if you filled out that short questionnaire, and all of the information that you include in our evaluation so that we know really what are we going to do, who's going to be accountable for it in the next 6 months, in the next year, in the next 5 years, so that we can start to show that progress and so that we can start to report back to the community and everybody can feel like they have that opportunity to really plug in and make a difference and ultimately be able to show that we've made homelessness rare, short-lived, and non-recurring. We'll definitely be in touch. We'll let you know the outcomes of kind of the summary of this conversation, the outcomes of our afternoon's conversation, and next steps, as well as how to be involved in those. So again, thank you so much for your time this morning. It was a fascinating conversation and just really appreciate everybody participating.